So I'm so happy to introduce Alexis Phillips from our ISN School Health Unit, who's going to be sharing the Student Health Survey Snapshot. Take it away, Alexis.
Hi, everyone. Good morning. Thank you for having me today. My name is Alexis Phillips. I have dark brown, blackish curly hair, and I'm wearing glasses and a sky blue colored top. I use she, her pronouns, and I am a policy and assessment specialist for the Adolescent and School Health Unit, which is housed within Adolescent, Screenwise, and Reproductive Health section of the Public Health Division at the Oregon Health Authority. Next slide, please. Today, I'm going to be sharing a high-level big picture overview or snapshot of data from Oregon's 2022 Student Health Survey. I'll give an overview of the Student Health Survey, or SHS, including what is it, who are the SHS collaborators, and describe some of its strengths and limitations. Then I'll share some of the data. I see that someone said that they can't see the slides for those who are joining virtually. Just putting that out there. But then I'll share some of the data, a forewarning that there are lots of data, but for today, we'll focus on 4 topics. That includes demographics and socioeconomic context, mental health and well-being, school climate and connectedness, and substance use. And then finally, I'll describe some of the upcoming changes to the SHS. So what's happening in the world of youth voice and youth engagement, and then share some resources with you all. Next slide, please. All right, so let's dive in. Next slide. The Student Health Survey, or SHS, is Oregon's version of the Youth Risk Behavior Surveillance System, or YRBS survey. It's a comprehensive assessment that asks youth many questions about their physical and mental health, their school climates, and substance use. Previously, similar data was collected via the Oregon Healthy Teens and Student Wellness surveys. All public school districts are invited to participate. The Student Health Survey was administered throughout the school year in 2020, and the most recent data was collected in the fall of 2022, and that's the data that we'll be talking about today. Parents, guardians, and caregivers must be notified that the survey will be administered, but the consent process is passive, so unless they or their students opt out, students will have the survey made available to them. And the data is weighted at the state and county levels. Next slide. The SHS has many collaborators, including a few different divisions at OHA, the Department of Education, local school admins, the Coalition of Communities of Color, the Youth Data Council, which we'll talk more about later in this presentation, and also Oregon Tribes. Some of the great things about the SHS include the fact that it's one of the most comprehensive youth surveys in the US. The data is made publicly available. It supports many federal and state grants and reporting requirements, and it also allows space for change and responsiveness to community needs, which later I'll share some examples of this. And some of the limitations of the SHS include a lack of representation and underrepresentation from students with disabilities, students who are homeschooled or attending private schools, and students who are chronically absent. As I mentioned earlier, the SHS data was collected throughout the school year in 2020 and again in the fall of 2022, and these data are not easily trendable. And lastly, not everyone participates. So for example, the 2022 SHS data does not include Portland Public Schools and Salem-Keizer school districts. All right, so now we're going to start getting into some of the data. So overall in Oregon, there are more than 770,000 adolescents, which is about 18% of the total state population. Compared to 11% of all Oregonians, 18% of young people live below the poverty line. And interestingly, youth are more racially and ethnically diverse than adults and seniors across the state. This graph shows the student health survey student participation in 2020 compared to 2022. And so we can see that across all grades, there was a slight increase in student participation from 2020, as indicated by the pink bar, to 2022, which is the green bar. In 2022, student health survey participation made up 28 counties, 94 districts, 321 schools, and 46 of those schools have school-based health centers. Here we have the breakdown of gender identity for participants, which includes youth who identify as female, male, transgender, gender expansive, which includes demi-girl, demi-boy, agender, non-binary, gender fluid, and two-spirit, among several other culturally specific gender identities for American Indian, Alaska Natives, and Hawaiian Pacific Islander students. Across grades, youth who identify as male or female, there's a fairly balanced split, but you can see that there are less youth who identify as transgender and gender expansive. And youth who responded that they didn't know or didn't understand the question is 1% or less across grades. For all grades, most youth identify as straight at more than 70%, followed by youth who identify as bisexual or pansexual. Across grades, the majority of youth identify as white, non-Hispanic, as indicated by the pink bar, followed by youth who identify as Hispanic, which is indicated by the red bar, and additional racial ethnic categories include American Indian, Alaska Native, Asian, Black, Middle Eastern, North African, Native Hawaiian, Pacific Islander, and also youth who reported multiple races and ethnicities. These are some of the social determinants of health questions that were asked. So here I want to highlight food insecurity, which is the pink bar. 23% of sixth graders reported that they had eaten less than they should have because there wasn't enough money to buy food, followed by 18% of eighth graders and 19% of 11th graders. So moving into our next topic, which is mental health and well-being. The mental health and well-being data shared will show these 4 key takeaways. So youth are experiencing substantial health and wellness challenges. Youth who identify as queer, transgender, and female experience significantly more distress and less support from adults than males. Among 11th graders, American Indian, Alaska Native youth report higher rates of mental health challenges. And one caveat to these mental health and wellness challenges is that the majority of youth report having a safe space, a safe place or person that they can go to for help outside of school. This slide shows data from 3 mental health questions that asks youth about their experiences with depressive symptoms, self-harm, and suicidal ideation. And here we can see that the percentages progressively increases for 8th graders at 32%, and at 32%, and 11th graders at 40%. And I'm looking specifically at the experienced depressive symptoms bar. So here's a closer look at the mental health indicators among 11th graders by race and ethnicity. So we see that for each indicator experiencing depression, suicidal ideation, or suicidal attempt, we see that among 11th graders, American Indian, Alaska Natives report higher rates of mental health challenges as indicated by the pink bar. For mental health indicators by sexual orientation among 8th graders, we see that youth who identify within the LGBTQ2SIA plus community experience higher rates of depression, suicidal contemplation, and attempted suicide. Although there are a myriad of mental health challenges that youth are experiencing, there are some mental health protective factors too. So here we see that across grades, more than 85% of youth have a safe person or safe place outside of school that they feel that they can go to for help. Among 8th graders, we see youth who identify as female, transgender, and gender expansive report less adult support than males, with only 66% of youth who identify as transgender reporting that they have a safe person or place outside of school to go to for help. 8th graders who identify as gay, lesbian, bisexual, pansexual, or queer also report less adult support than those who identify as straight. So now we're going to switch to describing some of the data related to school climate and connectedness. The school climate and school connectedness data shared will show these 4 key takeaways. So within schools, most youth feel like they have someone that they can go to for help. Many youth of color are less likely to feel that an adult at school really cares about them. In schools, about 2 in 10 youth experience bullying. Youth who identify as transgender and gender expansive experience higher rates of bullying compared to youth who identify as male.
Okay.
This graph shows 6th and 11th graders' responses to the question, who would you go to for help if you had a health problem or felt stressed during the school day? And so the majority of youth reported that they would go to a friend or classmate, followed by a parent, guardian, or caregiver, and then a teacher or counselor. And 5% of 6th graders and 4% of 11th graders reported that they would go to a school-based health center if they had a health problem or felt stressed during the school day. Most youth across 6th, 8th, and 11th grades agree very much that at least one teacher or adult really cares about them. Across sexual orientation, we see that youth who identify as gay, lesbian, bisexual, pansexual, and queer are less likely to agree that an adult at school really cares about them, as indicated by the red, the tannish green, and the pink bars. For students of color, the same is also true. In this graph, we see that while 59% of 8th graders, so that's the state rate, the dashed line, agree with the statement that an adult at school really cares about them, youth who identify as Asian, Black, Hispanic, Middle Eastern, and North African are less likely to agree. Oh no, I see there's an issue on the slide. Next slide, though. In terms of bullying in schools, we see that 19% of 6th graders, 26% of 8th graders, and 16% of 11th graders reported being bullied in the past 30 days. And when we look at these rates of bullying across gender identity, we see that youth who identify as female, transgender, and gender expansive report much higher rates of bullying in the past 30 days than youth who identify as male. And this is true across all grades. And the final topic that I'll talk a bit about is substance use. So the substance use data shared will show these 3 key takeaways. In the past 30 days, most youth reported not using substances. Overall, youth who identify as LGBTQ2SIA+, transgender, and gender expansive report higher rates of substance use. And similarly, youth who identify as American Indian, Alaska Native, and Native Hawaiian Pacific Islander also report higher rates of substance use. Here we can see that each 6th, 8th, and 11th grades and their reported substance use in the past 30 days. So the blue bar is the percentage of youth who reported that they drank alcohol in the past 30 days. Tan is marijuana use, and pink is vaped tobacco in the past 30 days. And we can see that the rates of substance use increases across grades, with 11th graders reporting the highest rates across all substance use categories. And this graph shows us the state rate of 3%, which there is an issue with the slide, but the dotted line, the dashed line, is 3%. And you can see that youth identifying as transgender and gender expansive report much higher rates of drinking alcohol in the past 30 days, with transgender youth reporting 12%. And bisexual orientation among 11th graders, youth who identify as gay, lesbian, bisexual, pansexual, and queer also report higher rates of drinking alcohol in the past 30 days when compared to the state rate, which you see as that dashed line. And so when we look at race and ethnicity among 8th graders, we see substantially higher rates at 15% of youth who identify as American Indian, Alaska Native, reporting that they drank alcohol in the past 30 days. And moving to marijuana use in the past 30 days, this graph is showing us among 11th graders by gender, those who use or reported that they used marijuana in the past 30 days. And so youth identifying as transgender and gender expansive report higher rates of marijuana use in the past 30 days at 20% and 15% respectively in comparison to the state rate, which is 12%. Again, that's that dashed line. And bisexual orientation among 11th graders, youth within the LGBTQ2SIA+ community reported much higher rates of marijuana use in the past 30 days when compared to the state rate. Again, that's still 12%. And by race ethnicity among 8th graders, we see that youth who identify as American Indian, Alaska Native, and Native Hawaiian Pacific Islander also reported higher rates of marijuana use in the past 30 days. Reports of marijuana use in the past 30 days increases among 11th graders, and this graph is showing us the breakdown of marijuana use among 11th graders by race and ethnicity. So notably, American Indian and Alaska Native youth report much higher rates of marijuana use at 19% than that state rate. Again, that's that 12% dashed line. And so the next couple of slides will describe some of the youth reports for vaped tobacco use. So this graph shows that among 8th graders bisexual orientation, youth who identify as LGBTQ2SIA+ reported higher rates of vaping in the past 30 days. And when we look at race and ethnicity among 8th graders, we see that youth who identify as American Indian, Alaska Native, and Native Hawaiian Pacific Islander report substantially higher rates of vape tobacco use in the past 30 days. And again, among 11th graders, we see similarities as we've seen in previous slides. 11th graders who identify as bisexual, pansexual, report much higher rates of vape tobacco use in the past 30 days when compared to the state rate of vape tobacco use. And so to conclude, I'm going to describe some of the changes to the SHS and what's happening in the world of youth voice and youth engagement. So during the past 2023 legislative session, Oregon's legislature passed House Bill 2656, which requires all school districts to offer 2 annual surveys, including a survey administered by the Department of Education and a survey administered by OHA, designed to improve students' health and well-being. House Bill 2656 also requires that parents, guardians, and caregivers are notified at least 5 days prior to administering the survey and permits an opt-out option for the survey. Because of this, next slide, please. Because of this, the Student Health Survey will be administered annually beginning next fall, 2024, as opposed to every other year. All districts will have to offer the SHS to their students. Participants, caregivers, and their students will have the option to opt out of participating in the survey. This is a big lift, so there will also be a new full-time staff in the Adolescent and School Health Unit who will support this work by encouraging data use efforts and promoting youth engagement in the Student Health Survey. And content development for 2024, SHS is starting this fall. I believe we already have meetings on the books in the next couple of weeks. So the Youth Data Council is an amazing group of Oregon youth ages 15 to 20 who provide insight and guidance to improve the Student Health Survey. Participating in the YDC is a paid opportunity that seeks to address health equity and advance racial justice by amplifying youth voice. Another thing that's happening in the world of youth voice and engagement is the Student Health Survey qualitative data. So in response to lots of youth and community feedback in 2022, the SHS asked youth a few open-ended questions. One of them is, what helps you feel happy, healthy, and/or safe? Another open-ended question asks for context related to unmet mental health needs and absenteeism. And these are a step toward a more strength-based approach. And we're at the beginning stages of data analysis for these open-ended questions, and we hope to share out major themes soon. So thank you all for your time. I think I'm within time, which is great news. And I know that was a lot to get through, so I'll leave you with this. The Student Health Survey link is here. This is where you can find out more information about it. There's also a Student Health Survey portal where you can go in and access state and county data yourself. If you want school-specific data, you will need to contact your principal directly, and they'll be able to get you connected to that. And then if you'd like to reach us, you can find out more about the Adolescent and School Health Unit, of course, at the link. And also you can reach out to Sarah Nipper, who is our research and data lead, or myself. And now I'll open it up to questions, if there are any.
Thank you so much, Alexis. There's so much to unpack in the Student Health Survey data. Really appreciate you running through all the analyses that you all are doing. And I feel like this is like a tiny window into all the information that we get from the Student Health Survey. We do have some time for questions. We have mic runners. If you have questions, raise your hand, or you can show like your ping question mark, and our mic runners will come to you. Any questions about the data Alexis shared? Any of the changes coming in the Student Health Survey? Sarah Nipper.
Okay, I don't have a question, but thanks, Alexis, for sharing all that data. And I just I know that while I and many of us in the SPO think data is like the most scintillating thing, it's like the reason why we get up in the morning. I'm guessing that for some of you, that's like not like that's maybe not. You have different things that get you up in the morning. But I do just want to like bring it home a little bit. These slides will be available to everybody. I would encourage folks to like take a little bit of time and look, because there's so much in there. And also, as Alexis mentioned, with this legislation that is requiring all schools and districts in Oregon to offer the survey, which means, kids don't have to take it, right? And parents can opt them out, but it means that in all of your schools and districts, there will be survey data available on your youth and your populations. And so I just want to make sure that's in everybody's heads, because I think one of the goals for us is to really, we are getting this new position, as Alexis mentioned, to really strengthen those connections between bringing that data home. What does that mean for you and the kids that you're serving? We're going to have this qualitative data where kids are saying, yeah, I missed school and here's why. Yeah, I had unmet mental health needs and here's why. Here's why I couldn't get them met. And so one of our goals, I think, is to really make that really useful. And that's the whole point, is to make it useful to you all. So I just want to make sure that folks are kind of tracking that a little bit. And I know that a lot of these data points, you see the impact of them with the populations that you're serving every day. But there is really a wealth of information as far as tracking those social determinants of health and looking at those subpopulations and what's happening with Latinx youth and what's happening with kids with disabilities and all the different populations that are being served. So I just wanted to make a plug for that.
Sarah, could you share when the analyses would be ready for that new data? When would people start to see those results coming?
Well,
For all of it, for 2020, the new survey, when that's going to be required for people? When can people keep their eye out for it? Molly's going to bring you a mic.
So the survey, 2024 survey, will happen in the fall of 2024. And then the data will be available probably by the spring of 2025, I guess. So still a little bit out, but yeah.
Go ahead, Ben.
is this on? Really? I'm usually more surprised by talking into a microphone. This might have already been addressed, but so do we have any information now about how many parents declined to have their students respond to this survey? How many students declined to do this as well? I just found it interesting that so many of these students said, oh, yes, I have a safe and helpful adult outside of school. It's yeah, because all your parents gave you permission to do this and they know that you're doing this. I'm really curious about the students that didn't feel safe completing the survey or weren't given permission to fill out the survey, to see how that might impact our perceived data here. Do you want this one? This one works.
Do you want to?
Okay, wait, no, it's working. So I want to just make one clarifying point, which is parents do not have to say, I give you permission. It's that they're sent a thing home, and then if they don't want their kids to participate, they have to actively say no. We don't know, because all of that is really controlled at the local level. So your school might know or your district might know, but we don't track that at the state level. It also depends a little bit. Schools have a lot of latitude as far as how they administer the survey. So it could be in a health class, it could be in an English class. So in terms of who, it's not that every student in the school necessarily is offered the survey. It just depends on how the schools decide to administer it. But we don't have data on the person. I would say that you can kind of look at the school level, and from what I have looked at, it's generally a fairly high percentage of the students in that grade who are participating. So it's not 50% of the kids are opted out. But I think you raise a really valid point.
Hi there. Just a quick follow-up on the very same question he asked. Do we have any idea what the percentage of the schools that are actually participating in these surveys?
This is as you.
Yeah, somebody's going back to that slide, I think, that Alexis put together that has the number somewhere. Nope, keep going. There it is. I don't know if Alexis, you have it on hand. I don't know what percentage this represents. But that at least is the number. And then the next time we do it, it'll be a lot higher. So 197 districts, and you're right. Ceci is improving our slides as we go. It's great.
Hi. I don't know if it's working. Oh, it's working. I can see how this info would be really good for advocacy work as you're trying to expand services into new areas. I'm just wondering if anybody in this room has ever asked a school principal for this data and like logistically how you got them to give it up to you, because I feel like that's going to be are they going to know that they have it? Do they know how to access it? And then will they give it to you? I'm just wondering if anybody here has any of that info in their advice.
Oh. Yeah, so we've actually used, we've requested that data. It's great for getting grants in. Anytime you're trying to get services in and funding in, it's a great way of explaining to the school district that we have to show the need. And so many times we've used that data, but you do have to have your champion in the school district, that you have that relationship to help them understand the why. And once they know the why, they usually give it out pretty easy.
So I'm from the Oregon School-Based Health Alliance. So we work with different communities planning for school-based health centers, and I will just say, I would say 90% of the time, nobody knows who got the survey, and it takes a while to figure out how to get it. So just plan to have some time and to ask multiple people. Yeah.
So one thing that is a little bit different with one of the links that Alexis put on the last page was to the portal. So in 2020, we have the online portal now, and all the principals and superintendents have logins to that portal, and that gives them access to their data. So it's a little bit less cumbersome than in the past, when it'd be like, find somebody to send me a PDF file, and we don't know who has the PDF file. And so now it is a login, and I know that this is a pain point for folks because we have to protect. We can't just send the login information out to everybody, but we have been reaching out to schools and districts to say up front, who else do you want to get this username and password just right out of the gate? And so for some, and that's been more or less successful, but for some places we have been the lead health educator is also getting it, and this is the new person that can control access. So the person who sits in the front office might have control of adding new people to be able to access the portal. I wish I could tell. I wish we had here's who has access in every school and district. But depending on where you are, and if you, the other thing is if you, for the next time around, we can also suggest hey, we know that there are these people in your district who really want data. What if we just added them? And we have to get them to say yes. We can't just do it. But if you want access we can't do it for 2022. But moving forward, you could email Alexis or I, and we could see if we could get the contractors to nudge a little bit. So.
I was just going to say really quick, I did the same thing where I was hunting down the information. I was super excited to get my hands on it. And so I reached out to our superintendent because our school principals, right? And so reached out and so then he was able, we were able to email someone at the office who he just said, yes, please give Brooke access. So then I got to go in and dig how I wanted it to get the information. So, yeah.
Any questions in the chat from our Zoom participants?
It looks like no at this point.
Okay. Any final call on questions? Okay. I think I'm going to turn it over to Melanie.